So I'm Connie Digolis. I'm the CEO of the Mental Health Council of Tasmania, and I'm also a member of CMHA.
Thanks, Connie. Now, could you tell us about the presentation? Because you wrapped it up beautifully at the end, saying that really what an authentic couple of examples we had there. Could you just quickly describe them?
Sure, absolutely. So we had two presentations, quite extreme topics. So we had one focusing on the LGBTIQ plus community, working with peer workers and the NDIS with Wellways, and then the other one was with WOMAC. It was with MACA. In the Alice Springs, and the challenges that they're having, which they're looking to address with peer workers in their organisation as well.
And what struck you about them, and that you particularly thought, wouldn't it be fantastic if the NDIA was in the room, which it was, to hear? What struck you about
Well,
them?
firstly, what they were talking about was projects which were really pilot projects, which had depended on funding to actually be able to establish them. But I think what really struck me with both of them was the authenticity. So the value that it was bringing to the organisation, to the services, to the clients who were within those programs, and to the peer workers themselves. It was just about coming out of their pores, the enthusiasm and the genuine worth that the organisations and the peer workers were actually talking about through that work. I think what we didn't quite really be able to nail down was, what does this mean for the NDIS? And so my question was really, and thank God there was someone in the room who was from NDIA, because it's so important when we still have debates around the value of peer workers, and that can come from all sides. And there are certainly still conversations that we have in our state, which is around tokenism of a peer workforce. To me, those presentations completely negated those arguments, and it's so important for someone like the NDIA to see the value that that kind of workforce can bring to the scheme and to the people that they're trying to bring into the scheme.
And tell us about the NDIA then. Does it recognise peer work in any way?
Look, it does. I know that there was some definitions that they had around a support worker that evidently peer workers came out of that, and then my understanding when they were questioned on that was no, they still felt there was an overarching definition that could include peer workers, but they don't specifically recognise peer workers. And I think we've got some work to do, and I would certainly support some work happening that would actually look at how do we make that more of a specific strategy? How do we start looking at the potential for peer workers to be part of NDIS and our LACs? So that's a great area that we could be growing something, as well as within the actual services where there are clients who should be looking to transition to NDIS.
Thank you very much, Connie.